Today we'll be discussing the importance of seeking help for post-traumatic stress disorder among veterans. PTSD is a mental health condition that affects individuals who have experienced or witnessed traumatic events such as combat, which is often experienced by military personnel. According to the U.S. Department of Veteran Affairs, it is estimated that up to 20% of Iraq and Afghanistan veterans experience PTSD, while roughly 30% of Vietnam War veterans have had PTSD in their lifetime. These statistics highlight the critical need for veterans to receive appropriate care and treatment. Many veterans face significant challenges when dealing with PTSD, such as difficulty sleeping, anger, anxiety, and depression. These symptoms can significantly impact a person's quality of life and interfere with their ability to work or maintain relationships. Many veterans may feel ashamed, guilty, or embarrassed about their experiences, which can lead to a reluctance to seek help. In addition, many veterans with PTSD may also experience other health problems, such as chronic pain, substance abuse, and other mental health conditions like depression, anxiety, or suicidal ideation. This makes it more challenging for them to access care and receive effective treatment. It is essential to recognize that multiple challenges faced by veterans with PTSD and the importance of seeking appropriate care and treatment. PTSD can develop as a result of experiencing or witnessing a traumatic event, such as combat, assault, natural disasters, or accidents. The severity and duration of the trauma, as well as the individual's level of exposure to the trauma, can increase the risk of developing PTSD. Some individuals may be more susceptible to PTSD due to pre-existing mental health conditions, genetics, or other factors. PTSD symptoms can manifest in different ways, and it can be grouped into four main categories: re-experiencing, avoidance, negative thoughts and feelings, and hyperarousal. Re-experiencing symptoms includes flashbacks, nightmares, and intrusive thoughts. Avoidance symptoms can include avoiding places, people, or situations that remind the person of the trauma. Negative thoughts and feelings can include guilt, shame, anger, or depression. And hyperarousal symptoms can include feeling jumpy, easily startled, on edge. While it may be challenging to seek help, there are many benefits in doing so. Seeking help from a qualified counselor or therapist can help veterans learn coping strategies, develop healthy habits, and receive effective treatment. It is also essential to recognize that seeking help is a sign of strength and courage, not weakness. Veterans who seek help for PTSD are taking an important step towards healing and improving their mental health. There are various types of therapies that are effective in treating PTSD, such as cognitive behavioral therapy, exposure therapy, and eye movement desensitization and reprocessing. Cognitive behavioral therapy, or CBT, is a type of therapy that focuses on changing negative thought patterns that contribute to PTSD symptoms. Exposure therapy involves gradually facing fears related to the traumatic event. And EMDR is a therapy that involves using eye movements to process traumatic memories. These therapies can help individuals identify triggers, learn coping mechanisms, and work through traumatic memories. In addition to therapy, medication can also be used to treat PTSD symptoms. Antidepressants, anti-anxiety medication, and other medications may be prescribed to help manage symptoms like depression, anxiety, or insomnia. Medication can be used in combination with therapy to improve outcomes. Support groups can also be helpful to veterans with PTSD. Support groups provide a safe and supportive environment where individuals can connect with others who have had similar experiences. Support groups can provide a sense of community, validation, and understanding. Some veterans may also find that support groups offer practical advice and information about how to access treatment and navigate the healthcare system. If you or a loved one is struggling with PTSD, there are resources available to help. The Department of Veteran Affairs offers a range of services, including mental health services, substance abuse treatment, and support for homeless veterans. VA medical centers and clinics can provide a wide range of treatments, including evidence-based psychotherapies such as CBT and EMDR. The VA also offers online resources such as self-help tools, educational materials, mobile applications that can all help veterans manage PTSD symptoms. Private organizations such as Wounded Warrior Project, National Center for PTSD, and Give an Hour offer counseling and support services to veterans with PTSD and their families. These organizations often have a team of professionals who specialize in treating PTSD and can offer customized treatment plans tailored to an individual's specific needs. In conclusion, PTSD is a significant concern among military personnel and veterans, and seeking help is crucial for those struggling with this condition. The challenges associated with PTSD can be significant, but treatment is available, and seeking help is a sign of strength. Veterans who seek help for PTSD can experience improvements in their mental health, relationships, and overall quality of life. It is important to recognize that recovery from PTSD is a process and that it may take time and patience to see improvement. However, with the right support, it is possible to manage PTSD and lead a fulfilling life. If you or someone you know is struggling with PTSD, please reach out to a qualified mental health professional for support.